Hi folks, Mez here with another video for Plan C, Diary of a Cancer Patient. I thought I'd produce this video in a slightly different location as my front room rather than the office. I did hope to bring a video to you earlier. However, there's a few things that stop me from doing that. So just a bit of an update before I go into the main topic of this video. Is an update on my overall health. I went to the clinic yesterday to get my PICC line flushed, cleaned. They took some blood tests, and it turns out that I'm something called neutropenic. And what neutropenic means is that I have a very low white blood cell count. And if I have a very low white blood cell count, that means that I don't have what my body needs to fight infections. And so I'm open to infection at the moment. When you go through chemotherapy, what happens is your white blood cells are wiped out for the first, I'd say, 5 to 15 days of your treatment. And slowly, as time goes on, your white blood cells start to pick back up as new cells are generated. I think it's been quite a while since my chemotherapy cycle 2 started. I think it's been around about 5-6 days or so, and the white blood cell count isn't as high as what the doctors and the consultants would have liked, which means, like I said, that I'm open to infection. I've just got to be a little bit careful. You could probably hear in my voice that I sound a little bit hoarse. I've got a very sore throat. I've got a cough. I feel drowsy, got low energy. And these are all reasons why. It's because I've picked up bugs from maybe interacting with my daughter, interacting with some people, and I've contracted that virus, that illness. So there you have it. It's nothing too serious. I've just got to be careful that my temperature doesn't raise above 38 degrees. If it does, then that's a red flag, and then I need to start calling the clinic, calling the hospital, getting seen, because things can deteriorate very fast from there. So having said that, with that update, and with the fact that I now need to kind of be a little bit cautious around people until my white blood cells increase, let's get on to the main reason for this video, and that is visiting a cancer patient. Now, when people hear that you've got cancer, I don't know if this is a cultural thing or not, but people want to come and visit you. It's like an instinctual reaction. They just want to see you to make sure you're okay. There's no there's no real health benefits of them coming to actually see a cancer patient, but they just feel like they should do something, and coming to see a cancer patient is definitely one of them. It's just to show that they're concerned, show that they care. And again, I don't know whether it's a cultural thing or not, but definitely in the Asian community, people, when they hear this news, they just want to kind of descend on you and see you. Now, you've got to be careful, as good intentions as they are. Like I've mentioned, when you have chemotherapy, for the first 5 to 15 days, you have no white blood cells, or you have very little white blood cells, which means anything that these visitors may have, whether they realize it or not, you will contract. You will get it. You will get that cold. You will get that cough. It's like I said, I've got a sore throat, so cough. I'm pretty sure that I picked it up from my daughter who's been to nursery, who's picked up those bugs. You know, you've got no immune system, and you have to be really, really careful, because if you contract something, say COVID or anything that even slightly gets into your system, it can deteriorate. And my situation can go downhill very fast, because my body just doesn't have the things it needs to fight this disease as it normally would. What happens is, after a period of time, new white blood cells grow, emerge, and they can start to fight off diseases that may attack the body. But as of right now, I don't have that. So I need to tell these visitors, and they can be anybody, friends, family, whatever, just to hold off from visiting me right now. And that can cause complications, that can cause problems, because people just want to see you, and they might get offended that you don't want to see them and things like that. But you've got to be a little bit selfish here, and you got to think about yourself and not think about their timeline. They might be free on the weekend, so they might schedule a visit and things like that. They're thinking about their timeline, they're not thinking about what's going on with you. So if you do know somebody who has cancer and you're thinking about visiting them, ask them, is now a good time to see you? And they'll know exactly what you mean, because if their immunity is low, then coming to see them at that point is a risk to them. And you don't, as a cancer patient, I don't want to invite unnecessary risk into my house, into me. So you've got to be clear in your communication that now is not the right time to see me, because I'm open to infection, because of my white blood cell count is low. Now is not the right time. They should understand. If they don't, then that's a conversation that needs to be had. But it is important to be selfish at this time. At this point, I would be hoping to kind of meet with a friend, go for a coffee, things like that, just to kind of be social and be normal, because I crave that. But the risk is too high. The risk is too high for any of that. I do have friends that drop by, and that's okay. Dropping by to kind of check up on me is something that I like. I have friends that do that, and for those that do pop by just to check on me and see how I am, thank you so much. But they know not to stay long. And what I say to people is the best amount of time to visit a cancer patient, when that cancer patient is receiving guests, should be between 30 to 90 minutes. And I say 30 to 90 minutes because, and this is going to sound really weird, but hopefully I can break it down in a way that you understand. When you're going through cancer, your body is fighting internally all the time. When you're going through chemotherapy, those drugs are working 24/7. Internally, it is tiring. And when you have visits as great as that is, and as thankful as I am for people that pop down and visit me, it is that interaction, that social interaction is also tiring. I have friends that drop by, they come for a coffee, they make me laugh, they make me joke, they tell me what's going on, and that's great, and I wouldn't want that to stop. I would never want that to stop. But there is also an element of the cancer patient has to then deal with the fact that that is an interaction that will tire you out. 30 to 90 minutes is an ideal time, excuse me, to visit, to converse with that cancer patient, to kind of give them a sense of normality, but not impose on them too much, whereby that patient is wiped out for the next 2 hours. Because when you interact with somebody, you're thinking about stories, you're thinking about memories and things like that, and that's great. I'm not saying it's a bad thing, but it requires a lot of excess energy that wipes a cancer patient out, that wipes me out. So when you're visiting a cancer patient, be mindful of that. You know, culturally, when guests come from a long way, they tend to stay for hours on end. You also have to kind of provide some kind of sustenance for them and things like that. That's taxing, not only on the cancer patient, but on the carers, the family. You know, excuse me. If the well-being um, and concern for the cancer patient is there by the visitors, then have a conversation with them first before turning up at their door. Talk to them, see if it's okay to visit, when is it okay to visit, and don't be offended if that cancer patient doesn't know yet. Currently, I have to take everything one day at a time. I thought that I would be absolutely fine by now. And with the weather getting better, we want to take our daughter to places. We want to, enjoy the weather, but my health could take a turn at any point. And therefore, it makes planning really, really difficult. Like I said, the best time to visit a cancer patient is roughly, and this could be different for different people going through cancer, but for me, it's roughly 2 weeks after the cancer treatment. That generally seems to be the best time whereby I have enough energy, my white blood cells are up, and I can feel a little bit like myself again. Right now, I'm not feeling myself. Right now, I'm very drained, I'm very drowsy. I'm feeling the effects of the chemo, and trying to be yourself and trying to keep your spirits up for visitors and guests is draining. So that's kind of what I wanted to address on this video. I love having visitors. I'm not saying to any of my guests, don't come. And you're going to get people that randomly turn at your door, which is a little worrying, especially when your white blood cells are low. But, it happens. You've just got to deal with it. Visiting people makes me feel normal. Interacting makes me feel normal, but you have to think of your own health first. And that means when you're neutropenic, when your white blood cells are low, then you have to step away from that social interaction and just think about your own health. And that's where I am at the moment. So I hope you've enjoyed this video. If you've subscribed, thank you so much. Please make sure you click on that bell to get indicated about when I do my next video. Hopefully I won't leave it as long before the next video. It all depends on my health and how I'm feeling. But if you found it interesting, let me know in the comments. Let me know if you know me personally. Thank you so much for everybody who has kind of checked in on me, and there's been quite a lot of people. So thank you so much. You guys are keeping me going. Again, thank you. Until the next one, take care.